So Dr. Wright Pinson from Vanderbilt University Medical Center is here with us today. He is the Chief Health Systems Officer for VUMC. Dr. Pinson, welcome. We appreciate you being here.
Well, thank you, Jim Shulman. I appreciate being invited.
Well, so let me first say that I'm very proud of your work, and thank you for what you're doing for the city and the state. I know you've been really busy with all that. Let's just, let me ask the first question, which I was told to ask, which was, how many cymbals do you use in your drum set? That was the first most important question I was told to ask first.
Robert Early would pay attention and just turn around and look. He'd know that I use 7.
7. Okay, that's very important. I'm writing that down. Okay, so what's the name of your band? I mean, I see it all the time, but what's the name?
Soul Incision.
Soul Incision. Got it. Okay, and you all have played at the Predators game, I know, right?
We have. We've been together an amazing 22 years.
22 years. And have you had any major hits during that period of time that I would know about?
No.
Okay, good. All right. So let's leave that. and so tell me, from your standpoint, and what we're going to do is I just ask a bunch of questions, and then people send in questions during the thing, and I've got like 12 questions already that people sent in. So from your perspective, as you saw this kind of unveiling, you know, first in China, and then, you know, it started going around the world, and then we figured it was coming here. Again, watching this thing happen and start happening, I mean, what did you think? I mean, we've never really seen anything quite like this before. So tell me what you think.
So in January, we were watching it unfold in China, and we immediately got a small team of administrative and operational leaders beginning to meet and plan for what could happen and develop our capacities. I think we got a lot more focused on this as the news reports came in from Italy and then from New York, and we began to have a sense of how bad this could be. We didn't really know how hard we would get hit in Tennessee, but we did understand there was the possibility that it could be really, really bad. Fortunately, we had more lead time than New York, and so we got together beginning in early March. We pulled together what we call our command center, which brought in about 30 or 40 leaders from all corners of our organization. We also reached out to the Metro Department of Health and the State Department of Health and the governor's office, because we understood that we were going to be part of a response. We also began communicating with our sister healthcare organizations in the metropolitan area. But inside Vanderbilt, we had a very deliberate development plan. We first focused on the outpatient issues because we were very worried with so many people potentially needing information and needing it very quickly, and also potentially needing medical care, that we wanted to try to get that work done away from the medical center, because we wanted to leave things here available to take care of the acutely ill. And so we put out a hotline very quickly with about 20 or 30 healthcare workers, and we had literally tens of thousands of calls on that hotline. And then we used all of our walk-in clinics as places to evaluate patients, again, trying to have that done elsewhere besides right here on our main campus. We also put up a couple of tents, and we added a whole new pod across the street from our emergency room if we needed it. All of that was built in very short order. Testing was the next thing we focused on, and there was no testing at first. And I was happy that our lab was able, within about 4 days, to develop testing capabilities. And I would tell you, over the past month or two, they have now about a half a dozen different platforms to be able to test on, which is really good because it's difficult to get the reagents for one or another. So having a lot of different platforms is important. The patients that did come in and that were sick but didn't need to be hospitalized, we set up a telehealth bank in order to call them every day or every other day to see how they were doing. The other thing we did is we developed a computerized mechanism to get their test results to them to cut down on unnecessary calls. So then after about a week of getting all of that outpatient work set up, we began to focus on the inpatient. And so the first step was to do some modeling, try to figure out how many patients we were likely to see based on the data that was available for our part of the country. We knew that this personal protective equipment was a huge issue in other parts of the country, so we directed our supply chain folks to busy themselves trying to get hold of the masks and the N95 masks and the gowns and ventilators, because we understood that those were in short supply, and the way equipment was being procured became different. The supply lines, the intermediaries became very different, and so it took a very sophisticated effort there. We also did an inventory on the number of beds that we had here, and then we contemplated where we could develop beds to take care of these patients. Then you had to figure out how much staffing you would need. And as you might imagine, as you open up more beds, you need more nurses and you need more other ancillary personnel to take care of it. So trying to figure out where you're going to get thousands of healthcare workers to augment your capacity became a big issue for us. Trying to find physicians who would be able to cross-train and take care of these patients was another piece of work for us. And we actually developed an internal labor pool where we could move patients from areas that were going to be shut down into areas that were likely to be very busy. And we cross-trained our doctors as well. A big piece of this was communications. And so we developed a very sophisticated communications process internally. And we had all of our department chairs meeting every afternoon. We had this command center meeting twice a day. And then we put out information on our internal web every day, putting out new policies and new procedures and new activities. And we chronicled it all on a website that actually anybody can get to get information that they might like to have. Another thing you might find interesting is that many of the healthcare workers did not want to go home. And so we leased a hotel so that healthcare workers who thought they might be exposed and didn't want to go home would have a place to stay. We also looked for a place for people who were COVID positive, who didn't want to go home or come to work. We found a place for them to stay. And then the last thing I'll mention is, as you know, the state and the metro were trying to develop alternative care sites. First, they were looking at the metro center, and then they've looked at a number of other locations. So we were pretty active in trying to help support that work on the part of the state and in part of the metro. So I guess that gives you a little bit of a rundown of kind of how we approached it over about a 2 or 3 week period of time. I think you get a feeling for how many pieces and parts there were to all of this.
So I was going to say, I don't have any other questions. That's amazing. No, I do have lots of questions. So I will say that Jason Mumpower is on the call. He's the deputy comptroller, and I know that council member John Rutherford is on the call as well. So let me ask you this: how did you all? So early on, particularly, we knew that you all were starting to test. This was before Metro had its testing supplies together. So this was early on. Just based upon what I just heard you say and what you all were doing, how did you all know how to do this? Were you watching other, New York obviously had this wave of cases, but did you all have a plan already sort of in place in case something like this were to happen? Or were you watching other places and then sort of following a lead?
Well, we have emergency medical plans in place to deal with tornadoes and mass casualty events of all kinds, and that also includes plans to deal with a pandemic. Now, having said that, when the magnitude of this one became clear, we certainly amped up our plans very significantly. And as you just mentioned, testing was a major issue. And fortunately, we have enough depth in the lab over here where they are able to develop tests. And early on, they actually developed their own test. And we used that for a period of time before we were able to get reagents to set up some of the other platforms that I told you we've subsequently developed.
Right. So tell me about testing, because that is one of the questions. So people, early on, there were concerns about, if I call the health department here, I was supposed to call them first. Would I get tested or not? You were only supposed to be, have some symptoms before you got tested. And then the governor came out with his plan where it was testing and it was open to anybody. So where are we with all that, if you know? And then second of all, there is confusion about how long it actually takes to get the results back. I know that I've seen where, you can get a result back really, really quickly. Other people are waiting days to get a result back. Different testing capabilities out there as well.
Well, there are a lot of ways to explain the difference in times for test results. One thing has to do with what our actual testing capabilities were. And what I mean by that is the ability to see people and gather samples and then turn those samples into a laboratory and then have the laboratory run the test and report the test out. And our capability here at Vanderbilt was at first only in the hundreds, 100 or 200, and over time we got to where we could do about 750 a day. We were so overwhelmed early on in the evaluation of patients that we had to start sending tests out to other laboratories to turn results around because we were finding ourselves getting 3, 4, and 5 days behind. And so we sent them out to a variety of other laboratories. But the turnaround times from those labs also depended on how busy they were. And we found, in fact, that some of the tests that we sent out were taking even 12 and 14 days to get returned. But the testing capability has now amped up. All the healthcare systems are in pretty good shape. The city's in pretty good shape. The state is in pretty good shape. And so I would say the turnaround time now is anywhere from 1 to maybe as much as 4 days, but it's getting where it's pretty good. Now, moving on to one of your other questions about where can people be tested and under what circumstances. Well, we were at first only testing people who were symptomatic because we didn't have enough tests to test everybody. And so we wanted to focus on people who are symptomatic. And what we were finding is people who had respiratory symptoms or fever or other possible signs of COVID-19, 9 times out of 10, they just had a cold or they had allergies. So our testing was turning positive only 10% of the time, even when we were testing symptomatic people. And we have subsequently begun to test some people who are asymptomatic. And what we're finding out is the rate of positivity there is only around 1%. But in order to do a better job of public health, we are moving into the era now that testing capability is moving up of testing people who are asymptomatic. And you can go to any one of 3 community assessment centers that are now open Monday through Friday from 9 to 3. One of them is at Nissan Stadium. One of them is at Meharry Medical College. And one of them is in the old Kmart parking lot in Antioch. And they're pretty efficient. I'm told the wait times there are under 10 minutes. There's no cost to the patient. And anybody who wants a test can get a test. And the good news is between all of us in Nashville, we're able to do probably 6,000 or 7,000 tests a week. If you just want information about all of this, then you can call the Metro hotline, which is 615-862-7777. It's 862-7777. That hotline is open 12 hours a day from 7 to 7. And again, those assessment hours are open 9 to 3, Monday through Friday, and anybody can be tested. And I want to make clear that the only information that they need is they need a way to get back to you with your results. And so those people who are uneasy at this time because of their immigrant status or whatever reason to give information do not need to be afraid. All that is needed is to get the information that is necessary to get the test result back to the individual.
Okay. All right. Let me ask you what, for a long time, I thought was just a basic question, but if you're asymptomatic, obviously, what does that mean? And it means that you're not showing symptoms, but is there, I mean, that's right, correct? You're basically not showing any symptoms. You have it, but you don't show any symptoms. Is that
That's
right?
right.
So is there any way to...
Most of us are going through life without any major symptoms. And when we develop a symptom for something, whether it's pain or whether it's shortness of breath or whatever it is, we then go seek care. And around this particular disease, COVID-19, we know that the symptoms are fever, shortness of breath, and a dry cough. We have also learned over time that a sudden loss of taste, sudden loss of smell. In some people, they develop GI symptoms, including diarrhea. Those are the symptoms that people develop with this particular disease. So when people get those, we call them symptomatic. Not everybody who develops diarrhea or develops a cough or develops fever has this particular infection. It could be one of many. And so that's why even when people come in with the symptoms that are consistent with COVID-19, only about 10% of them are turning positive because there's a lot of other things that have those same symptoms.
Okay. But obviously, the way I understand it is that you could have it, show no symptoms, and not know it, but you could still give it to somebody else because you're walking around, you're asymptomatic.
Well, that is not an uncommon feature of a lot of respiratory illnesses, that you get infected and there's a period of time where the virus is actually replicating itself inside your upper or lower respiratory system, and you are actually expelling those viruses before you have become sick. And then after a period of time, perhaps a day to 3 days, then you become symptomatic. And the time when you are most infectious is in that period of time just before you become symptomatic and early in the time period when you are symptomatic.
Okay. So is that why, that's why everybody is encouraged to wear masks? And is that truly a kind of effective way to try to help from spreading it?
So here's my answer.
Yeah.
I've got my mask with me.
So do I.
I absolutely do recommend people wear the mask, that when we think about what it is that we're going to do to stop spreading this virus, it is, if you're symptomatic, stay at home. If you're symptomatic, get tested and stay at home. If anybody is close to you, lives with you, they should stay at home and get tested. We should all wear masks because of this fact that even if we're asymptomatic, we could be carriers. The 1 or 2% of the population that I said that we have tested who are asymptomatic but turn out to be positive, we could all be that 1 or 2%. And so in order not to spread the virus through coughs or sneezes or just breathing, it is important to wear a mask. So anytime you are in public, anytime you're around other people, you ought to have your mask on. Yes.
Okay. So one of the questions, one of the initial questions that came in was, and you went through some of them just a second ago, but and obviously the city of Nashville, Davidson County is opening back up on Monday, limited way, phase 1. So as we get ready to kind of open back up, even if it's a limited way, besides doing everything that we're supposed to have been doing all along, practicing social distancing, washing our hands, staying in if you're sick or if your health systems are compromised, all those basic things we've been being told. Any advice about anything else we should be doing? I mean, obviously there's nothing, I think everybody's trying to convey all the information out. But the question was, if we follow all those other guidelines, are there any other ideas that you would recommend to be safe?
Well, there are a lot of things that come into play here. First of all, if you're over age 60, and if you have any of the risk factors like chronic diseases, hypertension, obesity, asthma, COPD, heart disease, liver disease, kidney disease, your best bet is to stay home because you can't be 100% assured that you're not going to run into somebody who's got this virus and is shedding it. And we know that the severity of this illness in people who are over 60 or have these comorbidities is much, much higher than it is in people who are younger or don't have any of those comorbidities. If you're young and don't have any of these comorbidities, the likelihood of a hospitalization or a serious problem is maybe around 1% or 2% at the most. But for individuals who are getting up in their 60s and 70s and have these comorbidities, the likelihood of a serious problem is perhaps 10%. And the mortality rate altogether is maybe 5%. And I don't think any of us would go jump in our car and go for a drive if we thought there was a 5% chance that we would have a fatal accident. And so I think people need to think about that in terms of, if you're in a high risk category, are you really willing to take that kind of risk? So that's the first thing, is that people who are older and have a high risk should stay at home. The second thing I would recommend to people is check your temperature. That if you are not eliciting any of these symptoms and you don't have a fever, then it's a pretty good chance that you don't have this disease. We've already talked about the importance of masking. And I know it's weird, but it is a new day. And I think for the next few months, people need to get used to wearing a mask outside of their house. The next thing I want to talk about is washing your hands. That the way you pick this virus up is either somebody coughs or sneezes or breathes out the virus, and you actually breathe it in, or as they cough or breathe it out, it settles on a surface, and then you touch the surface. And then the next thing is you touch your face. And interestingly enough, we all touch our eyes, our nose, or our mouth subconsciously over 40 times an hour. And so if you're just touching things that other people touch, let's take a doorknob, a common doorknob into a business or into your home, that is a place where other people are touching that knob. Or take a table, a common table that people are using. That is a place where that virus might be located. And so it is important, after you have contact with materials that other people may have had a contact with, that you wash your hands or use one of these hand sanitizers that has a lot of alcohol in it. And all these hand sanitizers have in them is something that's more than 62% alcohol. And so if you wash your hands for 20 seconds, or you'll put one of these hand sanitizers on for 20 seconds, it essentially wipes out the transmissibility of the virus. I'll also mention hydrogen peroxide is another good material to work with. And the third one that I'll mention is very dilute bleach. All of those are good cleaners. But anyway, washing your hands and cleaning surfaces that other people have used is another important piece.
All right. So usually I wait for a little while before I get to the big questions, even though those have been pretty important so far. But I'll go ahead and jump in because we're getting traffic on it already. It's about vaccinations and the drug that was recently approved by, at least to try to see if it would do anything. I can't even pronounce its name. It starts with an R. So tell us what do you know about the vaccinations, the possibilities, how long it normally takes on something like this? I know all these countries are working on it. I see there's like over 100 that are being worked on right now in different places. But what can you tell everybody about vaccinations? What is the likelihood we'll find something maybe this year? And if we do, how long does it take really to know that it's effective? And then about how long, assuming we find something effective, how long does it take really before it can be available for people to take? That's a lot of questions, but it's all around, vaccines.
Okay, well, I think in general, we have to look at how we treat a disease and how we prevent a disease. So any of these medications that we might use are ways to treat it. And we've already talked about the single most effective treatment that we have today, which is to not transmit it, social distancing. And then there's the prevention, which is the vaccine. So let's talk about what is available in terms of treatment. So there's been a lot of talk about hydroxychloroquine, and it is only a mild benefit at best. And in fact, there are a lot of side effects, cardiac side effects of hydroxychloroquine, so that the use of that drug, I think, has to be placed with a great big question mark.
And that's the one. That's the one that dealt with malaria. Is that right?
That's right.
Yeah. Okay.
And there are a lot of trials right now. That's the good news, is there are very active trials, and the accrual to those trials is very rapid. And I predict we're going to be able to say something very definite about hydroxychloroquine within about a month. We'll have the answer to that one. Then the drug with the R is called Remdesivir, and that's an antiviral agent that was actually developed for other purposes in the past, and it has been brought back out for this one. And there is one study so far that demonstrates that it's shortened the length of hospitalization. And that's great news. What that would indicate is that it is actually effective at shutting down the reproduction and transmission of this virus. The really great news about that is that those were all people who were in the hospital that were pretty sick that got that. And if we could figure out how to get remdesivir or something like remdesivir delivered to patients earlier in their course, then this would really become perhaps a very effective treatment for us. There are definitely other medications out there, and the great news is there are trials that are going on. But I think it's a matter of months before we're going to have definite answers to those additional trials. Another one is using convalescent serum from individuals who would have developed their own antibodies, and then you pull that out, filter that out of somebody's serum, and give it to somebody else. And that notion of using convalescent serum is also in investigation, and I don't think we can definitely say yet whether that's going to be effective. So then, Mayor Shulman, the third part of this was vaccinations, and everybody is going all out on the vaccination. We've got a lot of work here at Vanderbilt that's going on, and my understanding is that there's 80 to 100 different locations around the globe that are actively working on it. And so it will be a matter of somebody getting lucky and a likely suspect coming through, and then you have to do all of the testing. And that testing, you have to make sure that it's safe, that there's not a lot of side effects to this, and then you have to produce it, and you have to produce it in mass quantities, and then you have to distribute it. And I think all of that would say that the best guess for how long it will be before we will have a effective a vaccine, I would think, is 12 months to 18 months.
Okay. That's typically what people have been saying, but you're getting other information that's saying it'll be available by the end of the year, different things. So the testing cycle, let's say Vanderbilt, all of a sudden you said got lucky and found something that seemed to work, but then you have to go into a testing phase. How long does that testing phase actually, or is supposed to last, to make sure that you don't have side effects, or it doesn't obviously do something else?
Well, in the world of developing vaccines, the development and testing phase can be anywhere from a few months, a year, up to many years and decades. I mean, the whole process of developing vaccines is very complex and very time consuming, and is not ordinarily a rapid process. Now, a situation like we've got now, people will be doing what they can to speed all of that up. And then I'll add to that there are new technologies that are available to us today that haven't been available in past decades, that may make it possible for us to speed this up yet more. But I think the short answer to your question is it's usually many months to years.
Okay. Somebody just asked a question. It was, do researchers share information? Obviously, this is one of those things where we're all in this together. Everybody's trying to figure this thing out. But does a Vanderbilt University, share information with Stanford and other places, University of Chicago, any places like that are probably working on this thing right now, so that people aren't duplicating efforts, but everybody's sort of working together to find this right vaccine?
So absolutely. I think ordinarily people wait until they have confirmed data, and then they publish their data, and then they talk about it. In this case, since it is such an emergent situation, people are sharing their data earlier in that process. And so there's a lot of active sharing through telephone conversations and email traffic all around the globe at this time. The good news about that is it's unlikely that information that is important won't get shared early. The unfortunate news about that is, because people are sharing data early, it's possible that bad data or bad conclusions could be drawn to, and we could waste some time in the process. But overall, people are, I think, using their very best judgment to share the positive data that they have so that they can help other investigators. And I would tell you the same thing is true around health care. I'm absolutely amazed at the amount of information that is coming in from all of our doctors and all of our department chairmen who are talking to their counterparts around the globe and coming back with data around how to manage patients and how to treat patients. And I mean, we're finding better ways to manage these patients today than just 2 months ago. And that's a great thing. And let me just mention, in terms of we're all in this together, that all of the health systems in Nashville have definitely pulled together on this, and we're all talking to each other and figuring out how we can do our screening, do our testing, how we can make sure that we've all got adequate PPE. What are we going to do if we get overwhelmed at one hospital or another hospital? And so everybody, I think, should be happy to know that behind the scenes, we're all working with the Metro Department of Health, the State Department of Health, and things are very coordinated around the metropolitan area. And an amazing so inside of just 2 months.
And that's great. So one more question. Well, there was a question about the R drug and whether there is plenty of it, and do we have it? Let me ask that one first, and then I'll get to my second question.
Well, we have some at Vanderbilt. We were one of the places that developed Remdesivir. And so we are fortunate that we have a shipment in, and I can't tell you the exact amount because I don't know it. I know that the company that is manufacturing it is actively manufacturing it as quickly as they can, and I know they have shipped it out to a number of locations around the country. I think there's some concern about whatever formula was used figure out how it was shipped out so it's not equally available all over the country. And that's a problem. But I do know there is a shipment of it that has been distributed, and I do know they're actively making more.
Okay. That leads to a whole nother set of questions. And I was going to say, so how do you determine, or do you know how, let's say that eventually there's a vaccine that's developed. How do you get it out? So let's, I know that there was a story I saw last week about the United Kingdom working on a vaccine, and they think they may, or what happens if they come up with something and they would make plenty of it, but the first group that would get it would be Great Britain, and then we would get the second batch. I mean, this is a worldwide problem. So there's a race to find a vaccine. What happens when something is finally approved? How do you distribute something on a worldwide scale like that? Because aren't people going to be going like, well, we need it first, or we want it first, or, I mean, how do you figure that out?
I'm not sure I'm the expert to tell you how drugs and supplies and vaccines are distributed on a global fashion, but my presumption would be that there will be allotments that are passed out. That's usually what happens when there is a drug that's in short supply. We get allotments of the drug. We don't necessarily get all that we want, but we get allotments. And my guess is what will happen when a vaccine is available is it will begin to get shipped out globally in allotments. And we will all be sitting around waiting for our allotment. The second part of your question about how would we distribute it locally, I would tell you we would distribute those locally just like we've distributed tests, which is we would set up clinics where we are currently doing the evaluations and the COVID-19 testing. Those very same clinics would be set up for the purposes of giving the vaccinations. We would use the same process locally.
That's going to be an interesting one. I hadn't gotten that far yet. Obviously, we don't have a vaccine yet, but that's going to be interesting when that happens, just like the rest of this thing.
I don't predict the wait will be 10 minutes.
Yeah, okay, I get it. Let me switch to something, and that is the summer and the fall with this thing. So, what is your best guess about what may happen over the summer? And a lot of people are asking questions about, okay, so we enter into phase 1 on Monday, limited opening. You should check the Nashville.gov website. There's a listing of how this works. Phase 1, half capacity restaurants, retail, so forth. Be careful. A lot of those things aren't opening maybe until phase 2, some of the other things. And I know there was a question about, is there a concern about people kind of dropping their guard at this point? So that, I've been saying, look, just because we open on phase 1 on Monday does not mean the virus went away. It's still there, just like it was Sunday and today. So there's concerns about people going like, okay, I'm out, and let's run around and forget about social distancing. I know we can't do that. So what do you think happens in the summer? And obviously it's just a guess. And in the fall. And let me ask you that, and then I'll come back with a follow-up question.
Okay. So a lot of that has to do with how well we continue to distance ourselves. Again, the only effective treatment that we have today, the best medical treatment that we have today for this virus is to stay away from each other. It is a very infectious virus. It does transmit pretty easily. It is pretty amazing when somebody is infected, how many people they can infect if they're in a crowd. And you hear these stories of a funeral where everybody went away from the funeral and everybody was infected, or a family reunion and everybody in the family comes. I mean, it is entirely possible to have that happen, and it's just a signal of how infectious this virus is. So the first thing I want to emphasize is the roadmap for reopening Nashville that the mayor put out is actually a very good, reasonable process. And I think people need to get their hands on that thing. They need to read it, and they need to pay attention to it. Similarly, the governor has put out the pledge for reopening Tennessee responsibly. I've read that document, and I believe that's a very good document. And I think no matter where you stand on this issue of whether we have overdone closing the economy down or not, or whether you think we need to open it up or not, we don't even need to talk about those differences of opinion. There is really a very sensible common plan here, which is it is okay to go out as long as you do all of the things that I've talked about earlier, which is keep your distance from people, wear that mask, wash your hands, check yourself to make sure you're not ill. If you are, isolate yourself. If there's somebody that's close to you, you need to isolate yourself. This notion of isolating the positive cases is really crucial. Now, what happens this summer has a great deal to do with how people respond to the recommendations. As I've said, the mayor's roadmap to reopening is an excellent roadmap, and the governor's roadmap is excellent. And if we will follow that, then I predict we will have a gentle rise in the number of cases and a gentle rise in the number of hospitalizations, and we will move through the various stages of reopening. On the other hand, if people don't take this thing seriously and aren't responsible about it, then this thing will begin to spread again very rapidly. And then we will all be facing the fact that the public is becoming fearful. They don't want to continue to do business. The hospitals are feeling like they're going to get overwhelmed, and we're going to want to slow things down. And so I think the roadmaps to try to open business up actually are the best way to go. People just need to be responsible and follow those guidelines. If they don't follow those guidelines and they're irresponsible, then I think this thing's going to be bad, and it'll be bad as soon as this summer. So that's what I've got to say. And I think what we can hope for is that it ramps up a little bit from where we are now. I think we can all deal with that. And if we will continue to be responsible in opening up, I think it will continue to be at a moderate level that the healthcare system can deal with, the public and their fears will be allayed, and businesses can begin to get back to normal.
Okay, so that is very helpful and very good guidance. I think, so obviously they go back to 1918 and the Spanish flu. And then when that hit, it hit, I think, in the spring. It kind of was dormant in the summer, or maybe not as harsh. And then it came back with a vengeance in the fall. What are we watching that? Is that similar to what happened? Did people not do what they were supposed to do in the fall or in the summer, and all of a sudden it came back? Or is there something else to it? Besides practicing all the good guidelines we're supposed to do right now and through the summer, is there something that we missed or something that happened in 1918 that we could learn from right now?
Well, I think the question, one of the questions is, does the virus respond negatively to sunlight, UV light, heat, and humidity? And there is some data out there that says it does not tolerate any of those very well. and therefore the ability to transmit and infect goes down with any of those three factors. On the other hand, I've noticed that this disease seems to be doing fine in areas of the country that are hotter, like Florida. And so I don't think it's clear yet exactly what kind of a response we're going to get when things turn hot and humid. I just don't know. If it turns out that it does suppress the virus, then the fall may become a bigger problem. But I don't think we know whether it's going to suppress over the summertime for sure or not.
What are we looking for? So, I don't know if the mayor is going to continue his daily press conferences. My guess is he is going to be doing it for a while. What are we watching for as we open back up in phase one? I know we're looking at different, they're all looking at different numbers, hospitalizations, number of cases, the testing, everything like that. Is there something in particular? Is there one factor or two factors that we should be watching for as we watch those numbers, as we open back up, that give us an indication of whether we're doing it, we're actually doing it correctly?
Yeah. So one thing to look at is doubling time. How long it takes to get twice as many cases. And you can do that by looking back. You look at however many cases are reported today and look back and see how many days it was till there were half that many cases reported. And right now, we're in a very good place. We're up over 15. It's more like 16, 18, and that kind of a doubling time actually portends reasonable control of the situation. When we see that doubling time drop down to around 11 days, then I think it's going to be a signal to us that we better back up a little bit, that we're not doing as good a job with our social distancing as we need. So that's one thing I would look at is look at the doubling time. And if it's staying 15 or above, I'm thinking we're going to be in good shape. If it drops down around 12, 11, then it's going to be time to rethink what we're doing and maybe back up on that roadmap. The second thing that I think we need to look at is the number of cases that we're dealing with in our hospitals. Because I think we are okay with dealing with this as long as it doesn't get out of control. And I think most people are saying, look, as long as you guys in the hospitals can take care of this in a reasonable fashion, we're going to be okay in society. But I don't think people are going to be okay if they see the hospitals completely overwhelmed and see the healthcare workers completely overwhelmed and hearing stories about not having enough ventilators, not having enough personal protective equipment, the stories that we heard out of Italy and out of New York. I don't think people are going to be okay with that. And so I think we're going to want to watch and see how we're doing on our capacity in the hospitals. And we do have a pretty good bead on how many beds we have available. But what's even more important, we have an idea of how many ICU beds we have and how many ventilators we have. And I think when we start seeing ourselves getting up to maybe, within a couple of hundred of our capacity, we're going to know we need to back up.
Okay. All right. So I've got a couple more questions. I know we have about a little less than 10 minutes. The question about coming to Vanderbilt University Medical Center, if they have tests that they have to do, that type of thing. Everything seemed to be okay. People can come in, precautions are being taken by staff, that type of thing.
Yeah, so we have really thought about this very seriously about, how do we create a safe environment here because we need this to be safe for our own healthcare workers so that they aren't transmitting the disease amongst themselves or to the patients. And of course, we need it to be safe for the patients. The good news is we have taken care of all kinds of infectious diseases. And as I've told you, everybody who has the symptoms like COVID-19, well, 9 out of 10 have something else. And we're dealing with all of that. And so we have our isolation rooms, we have our isolation precautions. We know about wearing gowns and masking and washing our hands. And so we have all of that under control. What is a bit different around this one is that we know that people can be coming in because of that asymptomatic phase. So we are checking everybody's temperature at the door. We're asking them questions about what their health has been like the past few days. We are testing patients who are going to undergo procedures here. And that's something that's a little out of the ordinary, is for everybody who's going to undergo a procedure, we will do a test within a day or two ahead of time, because we don't want people to get sick with COVID-19 in the middle or while recovering from their procedure, nor do we want them to infect the staff. So we're trying to limit all of those. And so we're actually testing all the asymptomatic patients. Beginning next week, we're going to test all of the patients who are admitted to the hospital. We're obviously cleaning things more assiduously than we have in the past. We are going to cohort the COVID-19 patients into a limited number of units, and then we're going to have the rest of our operation here be a COVID-free area. Now, the obvious question here is, what about testing your employees? And here's the conundrum. I told you we can do about 750 tests a day. So we can test most of the patients who are going to have procedures or are being admitted to the hospital, because we do 750 or less of those a day. But we have 25,000 employees. And we could test all 25,000 employees, but we would need to retest all 25,000 employees. And so with the testing capability that we've got, it's just not possible to do that. And so we have focused on testing all the employees that have turned positive in terms of symptoms. And what we have found in doing that is that we found 145 out of 25,000 that have turned positive. And as we traced those employees, the vast majority of them actually became infected in the community.
Okay.
We have also followed those employees, and about 120 of the 145 are now recovered. So in terms of safety for a patient, I think the best we can do today is test all of the patients that are coming in and test all of our employees who turn positive until we have testing capability to do better than that. So just like I talked about out there in the world, it's important to wear masks and wash your hands and socially distance. We are doing all of that inside the healthcare environment. We are requiring everybody to wear masks, and we're requiring everybody to wash their hands very frequently, and we're setting up all of our flow of patients and visitors so that we keep everybody distanced from each other.
It is 10:59. I'll give you whatever you want to say. I'll give you a minute or two to say whatever you want to say to end this thing. We really do appreciate you talking to us and talking to all the people. We couldn't even get to all the questions, but this has been very, very informative and helpful. And we're getting messages from people saying thank you. First of all, I appreciate you giving us an hour on a Saturday morning. I know you're busy. I know you're working on all this stuff, so thank you. But anything you want to say to end this thing to people?
Yeah, well, first of all, I'm very happy to be here. You know, we're all in this together, and it's our time, and it's our time to step up and make things better. And so I'm delighted to be here to talk about it. I'm happy to do more. A couple of things I do want to say is there are a lot of issues around equity in healthcare, and this pandemic is making the disparities more problematic, And we are actively working on how do we communicate risks into those populations because they are getting hit the hardest. We are trying to work on getting equitable testing in the underserved, equitable care in the underserved, making sure they have access to clinical trials. And so one of the things I want to say is if there are people who feel underserved, feel at risk, please just reach out because we are eager to get transportation. We're eager to get people taken care of. We haven't touched on that point, and I wanted to say that.
Okay.
The second thing that I want to say is, again, the single most important thing that we all can do is follow the guidelines. So every business that opens up should be screening people at the door, should be requiring people to wear masks, should be cleaning surfaces frequently with one of those substances that I talked to you about earlier. People need to take this very, very seriously because the common pathway to get out of this is the most effective treatment that we have, which is stay apart and don't transmit.
Okay. I think that message has been made loud and clear. We're going to keep spreading that message. Dr. Pinson, thank you again. I appreciate everybody listening today. We have Darren Hall, our sheriff, on next week. Very much thank you again. And thank you for everything that you're doing for obviously everybody in our community and across the state. And it sounds like nationally, again, we're all in this thing together. We're going to keep pushing social distancing and good, safe health protocols. Again, thank you, and thank you for what you do. And everyone, I appreciate everybody tuning in today. Dr. Wright Pinson, very much appreciate it. Appreciate what you're doing. And again, thank you. Okay. Bye, everybody.